How do you know if your new symptom is real? You know you have TMS, Mindbody Syndrome, and your other symptoms are neuroplastic, but what if this one is for real this time? How do you know that this new one isn't an actual medical problem? This can be one of the most difficult things to navigate in recovery, but the answer is simple. You just have to wait. I know it's not what you want to hear, but I promise it is not remotely as bad as it sounds. And we'll get into it after this because obviously we need a quick disclaimer. Hi, my name is Tori and welcome to The Treatment Within. I am a psychiatric nurse practitioner, but much more importantly, someone who has recovered from severe neuroplastic symptoms and someone who has waited over and over and over again when new symptoms came on to determine that, yes, they too were TMS. Look, if you feel like you are in a medical emergency, like you are having the cardinal signs of a stroke or a heart attack, do not wait. Please seek immediate medical attention. If you are having difficulty breathing or swallowing or are having an anaphylactic reaction, please seek immediate medical attention. If you are falling over, fainting, or confused, like you do not know where you are or who you are, please seek immediate medical attention. Anything that could be life-threatening, please do not wait. But if you were just, say, having a new pain and you didn't just get hit by a bus or fall off a roof, you're probably safe to wait. Even if there was some minor incident that caused pain, something that you can pinpoint like that ouch moment, it is still probably safe to wait, especially if you know you have TMS or Mindbody Syndrome and a long history of neuroplastic symptoms. I can tell you thousands of times that I've had some twinge when I was going up the stairs or bending over or picking up something or tripping while walking or turning a tight corner when running. So many things that caused a brand new spanking pain or resurgence of an old one. There was never some major impact injury or violent force, and I always waited it out, and it was always TMS. And with all the other symptoms that aren't pain related, again, if it doesn't feel like your life is in immediate danger, try to wait it out. And what does waiting do? Well, waiting is going to give you more time to gather more evidence. So many times in my practice as a psychiatric nurse practitioner, I would have people on medication and they would come back for a follow-up visit and they would report, well, I don't know if it's working or not, and I'm not sure if this thing that I'm experiencing is a side effect or not. So what should we do at this appointment with this information or lack of information? Are we going to stop the medication, increase the dose, or try a new one? Aside from serious side effects, just like aside from life-threatening conditions, we aren't going to do anything. We are just going to give that medication more time. More time is giving us more opportunity for evidence one way or another if it is working or not working, or if a minor side effect is going to go away with more time getting used to the medication or stick around or worsen. So I'll just see you in a month and we'll go from there. And waiting sucks, I'm not gonna lie, I hate it. With TMS, I had heard of this golden rule. If the symptoms had lasted 3 months or longer, it was probably TMS because pretty much anything in the body heals within that time frame. And really super probably TMS if you have a history of TMS. Of course, we are going to, again, not say this about cancers, tumors, stroke, heart attacks, anaphylactic allergies, and other things like that, but if you have a TMS brain, it's gonna keep throwing stuff at you, especially as your older symptoms have lessened or completely resolved. Sure, that's great, Tori, but 3 months is a damn long time to wait. Yeah, I know, I didn't want to hear that either, and I thought that rule was gonna be really hard to follow. But it actually wasn't. Why? Because trust me, it's almost never 3 months of sheer hell before you can be like at the 90-day mark. Aha, it's TMS. You'll know before then, or at least have a really strong inkling one way or the other. And if you are like how I was in my recovery, the symptom that I was so worried about had already moved on to another new one to focus on well before the 3-month mark. Or even if the symptom persisted, I rid the doubt about the symptom being a major problem because I kept living my life and doing physical activity. Even if I still had foot pain in the same spot 90 days later, if I had truly broken a bone, there would be no way I would have still been able to walk and run the hundreds of miles that I had done over that period and not have my foot fall off. I also had some wrong assumptions about the 3-month rule. I originally thought, certainly for the physical pains, it was gonna have to be like this. You need to take it easy and rest for 3 months just in case. This is for real, until I saw if it was gonna get better or not. I know very well if I do not continue to expose myself and I just instead rested on the couch and did the wait and see, the symptom was gonna increase more than if I actually engaged in life and did physical activity. Classic TMS sign. If with every pain I had rested for the whole 3 months, I just never would have gotten off the couch. And I would have continued to ruminate and freak out about the symptom, and it only would have gotten worse. Similarly for non-pain symptoms, if I had gone to the doctor for everything that ailed me, I would have gone to the doctor at least once a week and probably seen like every medical discipline. I had already experienced this in 2024. Prior to knowing I had TMS, I didn't need to do it again. I racked up 10 medical diagnoses in a year when I previously had none, and all of them were TMS. That experience in 2024 served me going forward in knowing that if I rushed to the doctor, it was likely that a label was going to be put on me and it was going to perpetuate the symptom. Even if the symptom lasts for 3 months, you will see over that time frame the variability in the symptom throughout the day, throughout the week, depending on your activity level, if it changes at work or school, etc., etc. And you can start to see where the symptoms don't make sense. You will see the shifting in the intensity, how it feels, maybe in the area of your body, if it lessens when another symptom arises. Even if it's a brand new symptom you never had before, you will still be able to draw the parallels to your old confirmed TMS symptoms, where this one's behaving exactly like the old one did. You'll be able to start seeing soon enough that it is behaving in a TMS way, or it isn't. Recovery is really about time. Oh, the old adage, time heals all wounds. It's so annoying and no one wants to wait to feel better, but really time is your best ally. Waiting, noticing, gathering the evidence will just continue to strengthen the case that you have TMS, and even new things that you've never had before are also probably TMS. And I know it sucks to get new symptoms, especially when you've worked so hard that the old ones have lessened or gone away. But it's actually great because with those, the more and more obvious it becomes that you have a TMS brain. And the more and more you understand that, the less and less new things come and the less and less they stay. Eventually, you don't have to wait and wonder if every new symptom is TMS because you've seen this enough times to recognize the pattern. You just keep living your life, and the symptom becomes something you notice, not something you need to figure out. Certainly not for 3 months.